hope to get it done in the 10 minutes that I have so I can post it on YouTube. This is the main sign at the entrance, and here is the main entrance to the hospital. And patients come in here and they get a dossier gets started on them by over here, and they carry that dossier with them for as long as they're a patient. If they go home, they bring the dossier back. These are patients who are waiting to be seen. Here is the French urgency, where the French are seeing the patients. And then here is the American urgency. And this is where the Americans are seeing the patients. I have to admit that the French side looks much more organized. These are the tents that the French put up when they first got here. And the tents are 8 people in the tent. There's an air mattress. There's no sex discrimination in terms of what tent you go into. 4 of the tents are American now, and 4 of the tents are French. So that's a total of 64 patients who we have as inpatients. The French also have a tent that is set up. This is the post-op immediate. This is the post-op area right here, or the patients who come in from the emergency room and are in more critical illness. The French then have their follow-up clinic in which they follow up with patients that they've seen that come back. The Americans aren't that organized. And this is one of the clinics. This is a patient that I just saw with the French doctor who has a foot drop, and with Dr. No. That is Dr. No. He's one of the orthopedic surgeons who is here from Haiti, and this is the hospital where he normally works in. And I've already done several cases with him, and we're going to be doing a gastrocnemius flap for a non-healing tibial ulcer, non-healing tibial fracture this afternoon. The gentleman in the dark blue shirt with the red stripe are the French firemen who do transport and do almost everything. This is the first of the French tents. The patients do all of their care here. The patients do not, their family stays with them. It's much safer here than a lot of them have on the outside. Now we're coming into the last of the French tents, and this is the last of the French tents. And the tent over there is the first of the American tents. That's the second one, and this is the third American tent. And here is the fourth American tent. I have several patients in here that we have. This is the courtyard of the hospital, and you can see this is the wing that has the patient rooms. There are 4 floors of patient rooms, 2 through 5, and the bottom floor is radiology and administration, period. This is the main part of the hospital where we have the operating rooms, where we have central stores, and I'll be showing you these. I'm now entering the hospital. These are the stretchers which we use to transport the patients around. You can see the sign Sector Front says. This is the laboratory, and this is where they do some of the testing. And although it really seems strange doing CBCs and doing other tests, because there's absolutely nothing that we can do with the results. We Then this is the pharmacy, and drugs come in just willy-nilly, and they're then separated out and organized into the pharmacy. I'm coming around to the central stores. This is where all the equipment is, and again, supplies come in and they separate them out and they store them here. I'm then going to walk back to here towards radiology, and then I will walk up to the operating room. This is the urgency, this is the emergency room. The French are using it for their minor procedures and their dressing changes. Whoops. And here I am entering radiology, imagery. This is where most of the damage in the hospital was done. This is the echo room. And you can see the damage that was done in here. This is the regular x-ray room. You have a CT scanner which is up one floor on the second floor, and it is getting, here's the CT scanner on this floor, and they are working on trying to get it repaired. We understand that it will take some time. This is the room where the American staff kind of chill out while they're between things, and this is the typical lunch that they give us. It's beans, rice, corn, and we've been getting sardines almost every day. This is the board of people who are here and when they're leaving. The unfortunate thing, if you look, is that 3/4 of the staff is leaving by Saturday, and so far we don't have any specifics that are replacing it. We have physicians well staffed through the 12th, but nursing and EMTs is going to be very tight for a while. I'm walking up. This is the way patients are transported and people get up and down. This is a crack, and it's been dated, and you see yesterday the crack only went to there, and today the crack goes all the way to the floor. This is a koi pond, and I'm walking up the stairs. This was an outpatient clinic. These are some of the transporters that we've just passed. And I'm walking up the ramp. This is the way since I can't use the elevator, this is the way all of patients are transported. Because there's so much damage in the round portion of the building, the patient portion, we feel it's unsafe to keep patients in it. So that's why the patients are outside. This used to be the endoscopy suite, and it was changed into a fully functional operating room. In a short while, I'm going to be doing surgery in here. And fairly old anesthesia machine.
Old surgical tech.
Young, beautiful nurses. And I'm going back to the main part of the OR. This is the main part of the OR. This is the room where we do conscious sedation, dressing changes, and small wound debridements. These are two of the new nurses that just showed up today, and nurse anesthetists and nurses. That's the autoclave that if that goes out, we're in deep doo-doo. This is the scheduling board where all the new cases are scheduled.